Hey YouTube, today I'm talking about a topic that I've known for a while I want to film on. I've been waiting for myself to feel comfortable enough to approach the camera completely barefaced with an acne breakout. But I'm doing it today. Now is as good of a day as ever, and so I'm ready to do it. I am going to be talking to you guys about hormonal acne, what it is, what it isn't, how to treat it, when to see a dermatologist. All of that will be in this video. Timestamps will be in the description box below if you want to skip to any particular section. But just so you guys know, if you're not familiar with my channel, the way that I do film all of my skincare related and skin issue related videos is to show you guys my bare face. So this is my bare face. This is my acne breakout. It is absolutely hormonal. I have several different types of acne going on, and I'll get into all of that as well. But I did want to show this to you guys. I know it can be a little uncomfortable. I've talked about that in other videos, but at the same time, I just can't help but feel that it's far more helpful for you as a viewer to actually see the acne breakout than for me to talk about it when my skin is completely clear, or for me to put on a layer of foundation and for you to not really be able to see it. Now, of course, I'm not a dermatologist. I want to make sure I'm very clear on that. My advice can never replace the advice of a dermatologist, and in fact, your dermatologist, it is always recommended that you see in person your own dermatologist if you are really dealing with anywhere from moderate to severe acne. If it's more mild, you may be able to treat it at home. If you can't, you still need to see a dermatologist. Okay, so I first want to start by addressing what hormonal acne is and what it is not. Before we even go any further, I want to clear up some misconceptions. Hormonal acne has absolutely nothing to do with poor cleansing, poor skincare, or poor diet. All of that is completely irrelevant. Hormonal acne is caused by hormonal influxes in the body at a very deep layer. This is why it's actually really hard to treat hormonal acne with over-the-counter topical type of products. It just doesn't work because it doesn't get deep enough to make any changes. Recognizing hormonal acne is actually pretty simple. In a young person around the age of puberty, it occurs in the T-zone. That's where we think of common acne, and that is indeed where 50% of people do suffer from acne, is during the puberty years. Now, for women ages 20 and up, it becomes 1 out of 4 women will deal with this, and that hormonal acne occurs right here in the face in what looks like a beard. And it's actually quite interesting that it occurs this way and very logical. So a lot of people don't think about this, but the fact that we were born either a male or a female is a simple flip of the coin that happened while we were forming. So because of that, the areas of the body that respond to hormones are actually the same in both males and females. So for males, they grow a beard, and for females, this is where we are prone to hormonal acne. Now, the hormones send a signal deep into the hair follicle to pump more oil. This is at a very deep level. This is why you can actually be a very dry-skinned person and still be experiencing acne, as is my case. Now, a lot of women are very familiar with this happening once a month, particularly at the time of their menstruation cycle. And that's of no surprise. That is when the hormones in the body do go kind of out of whack. This can also happen at menopause. This can happen if your menstrual cycles are affected at all, or if you're experiencing PCOS or anything else that will increase the testosterone in your body. Okay, so let's talk about the different types of acne. First, we have mild acne, which does not have to be hormonal. In fact, more often it is not. That is going to be blackheads and whiteheads. Now, both of these are the same thing in theory, but they appear differently. Both of them are little packages of bacteria that gets trapped in a pore, and the way that we see it varies between whether or not the surface is visible or not. So in a blackhead, there is no surface. It's actually open to the air, and that is why it turns black. The bacteria inside of the pore oxidizes, and it looks enlarged as well. Now, a whitehead is the same thing, but that skin is over it, and so you are continuing to see the white presence of the white blood cells and the bacteria. I have a whitehead right here. It is something that we see and recognize as common acne. It is something that a lot of people are tempted to pop. I don't recommend it. It does indeed make it go away faster, but it's dangerous in that it can spread the bacteria, and don't be surprised if you pop a pimple if you see more follow in that general area. Moving on into the moderate category of acne, this is actually where we see hormonal acne, and there's 2 types. There are pustules and papules. Pustules are similar to whiteheads. They look the same. You'll still see that little white bump full of pus, but you'll see a lot more inflammation around it. They typically stick around a lot longer. They're a lot more severe, and that right there is an example of a pustule. You can see the pus inside of it, but you see the redness all around it. Now, you also have papules, and those are stuck underneath the skin. Those appear as red inflamed bumps. They're usually tender to touch. I have a whole bunch of them right around here. Those are also a more moderate form. They take a lot longer to get rid of. We're talking 10 days is a minimum. You might see them for about 2 months, up to 2 months of papules. The last category is severe acne. I do not have any severe acne to show you, but I can show you what these are not. This is going to be nodules and cysts. Both of these are kind of similar in appearance to the papules that I have. They're deep, they're inflamed, they're often hard and tender to the touch, but they are definitely larger. Now, if you have those, you absolutely need to go to a dermatologist. There is nothing that you can do to treat those because of how deep and how inflamed they are. It is a lot of bacterial infection going on. Please see a dermatologist if you have nodules or cysts. I do want to briefly go over the options that you might be given if you visit a dermatologist. All of these do have cons, but there's still options to consider. So first off is birth control, which is used for both young and adult acne sufferers. This is a very, very common treatment because it brings to homeostasis your hormonal levels, which are of course the root cause of hormonal acne. This is not something that you can use if you are prone to any type of blood clotting disorder. Next we have anti-androgens, the most common of which is spironolactone. What this does is it reduces testosterone production in the body. This has been incredibly effective for many, many people, but do not use this if you are prone to low blood pressure or if you require diuretics. Next up, we have antibiotics. This can be either topical or internal antibiotics. This works because acne is a combination of your hormone production and still bacteria, so this can help to kill off the bacteria. The main problem with antibiotics is, of course, antibiotic resistance, which is a real problem. You can end up going off of antibiotics and having a resurgence of the bacteria, so this is used a little less nowadays, but it is still an option. And then the last category is retinoids. These are effective for mild to moderate acne. They are available at a higher strength through your dermatologist, but you can get them over the counter. And you cannot use these if you are pregnant. And if you use them, you must be very vigilant about using SPF as they make you more vulnerable to the sun. I want to add to this that Accutane is actually an internal retinoid. I don't know if a lot of people are aware of this, but it is not effective for hormonal acne because what it does is it works to reduce the size of your oil glands. And since hormonal acne is not really a problem of excess oil production, but rather a problem of excess hormones, it is not the most effective treatment to use. Let's talk about some over-the-counter treatments that don't require seeing a dermatologist. The first is going to be salicylic acid. I have the Murad Clarifying Cleanser, which is a 1.5% salicylic acid treatment, as well as the Paula's Choice Skin Perfecting 2% BHA liquid, which is salicylic acid at 2%. Both of these contain BHAs, which penetrate past the epidermis of the skin and do indeed help to treat acne at a little bit of a deeper level. Not deep enough if you're dealing with nodular or cystic acne, maybe not even deep enough for papular or pustule acne. However, this is a great treatment for mild to moderate acne. It will certainly help if you use this religiously. There's also benzoyl peroxide, which I do not happen to have, but it is a similarly effective treatment. Now this is the Badescu drying lotion, which I've talked about before, and I know a lot of people who suffer with acne use products like this. This will indeed bring the acne up to the surface of your skin, but there are cons to using it, that being that it is so drying. I would absolutely recommend that you continue to use a moisturizer along with this so that you don't create a situation in which your skin thinks that it needs to produce more oil. Then you might actually end up dealing with more acne breakouts as a result. So yes, this works. Proceed with caution. Now this is the Ordinary's Glycolic Acid 7% Toning Solution. You can use any type of glycolic acid to get what I'm about to describe. And what this does is this is a very deeply exfoliating product. This will help to remove the dead skin layers that you have on your skin. And therefore it can actually prevent acne scarring. I recommend using this as soon as an acne breakout clears up, when you still have a little bit of that signs that it was there. If you start to apply this very quickly, it will absolutely prevent acne scarring, and you can still use it on acne scarring that's been there for a while. It will still treat it. For over-the-counter retinoids, we do have options. The Ordinary has their advanced retinoid at 2%, which is a very cost-effective retinoid that does not require seeing a dermatologist. This is a good option if you're on a budget and your acne is mild and you're not really sure what you want to do. I recommend giving this a go. It is gentle, but you will still see results. You'll see a bit of clearing up. Absolutely make sure, if you are using a retinoid, make sure that you are applying sunscreen even for very, very brief spans of time that you may spend in the sun. this does make you absolutely more susceptible to a sunburn. I want to give you guys a couple of natural options for treating hormonal acne. The first is going to be tea tree oil. I happen to have the Body Shop's tea tree oil, which is a very affordable but also very effective antimicrobial product. What this does is it kills bacteria at the surface of your skin. If you have done the damage of popping a pimple, I highly recommend following that up with something like tea tree oil or what I'm about to show you after this, because this will help to kill off bacteria on the surface of your skin and definitely help to prevent any further damage than what you've just done. I also have The Ordinary's 100% organic cold-pressed rosehip seed oil. Rosehip seed oil is also antimicrobial, also will kill bacteria at the surface of your skin. Alright guys, so that is my video. I hope you found it helpful. I hope it was not too disturbing for you to watch. I really appreciate you guys watching. If you did enjoy this video, please give it a like and hit subscribe for more videos like this or whatever I feel like filming. Thanks so much for watching, guys. Peace out, YouTube.